I'm gonna have my coworker draw my blood.
And
Thank you, look at my blood.
now we could clone her.
Now we can clone me. Hey y'all, so we are headed to work right now. That's what we're doing. But first I gotta go get my coffee, and then it's phlebotomy time, baby. I know I haven't recorded and vlogged in a long time, but I've been really busy. I'm a full-time student and I work full-time as a phlebotomist, and I'm full-time mom, so it's, you know, it's a lot going on. I can't believe, you guys, that it's been 3 years, almost 3 years, since I've started this phlebotomy journey, and you guys have been so supportive, and I thank you guys so much. And now I'm to the point where I just want to keep moving up the ladder in the laboratory, because that's what phlebotomists are considered. We're considered laboratory. Before I go into work, I always stop and get my coffee. I am headed to work. I am on my way to clock in. Woo! Donuts! I just arrived to work. So now I'm gonna put on my face shield, button up my lab coat, and I'm going to stalk. I'm gonna stalk and clean up a bit. Alright guys, so I start cleaning as soon as I get in. I put on my PPE and then I clean my keyboard, my computer screen over there, my chair. I just start wiping stuff down. I spray my viral stuff. And then I organize everything. I clean inside here. As you can see, there's a little blood here. Not okay. We clean. And then I have to, since my sharps is filled up here, I have to replace it. These are all of our supplies.
Okay.
Looks much better. So I'll just walk to the front, call their name on the rec, sit them down here in the seat, go over everything in the computer, make sure everything's correct. It's my coworker. Make sure everything's correct in the system, in the computer. Make sure they are who they say they are. And then I start drawing their blood. So this is what I do. I come here and then I grab appointments. I grab requisition, you know, the recs, appointments, or the walk-ins right here, and it will be like stacked with like patients, all the requisitions. I take the requisition, I come out here, and then I call a patient to come back so I can draw them. All right, yeah, so I just had a patient. She's pregnant. So sometimes you'll receive like specialty testing or kits regarding pregnant women. You'll see them a lot. All you have to do is open the kit, read the directions, follow the directions, and you'll be fine. And sometimes we'll get kits. Here's her rec. You can't see the rec, but on this rec, it has all her information and her doctor's information and address and billing, her insurance. You might get like kits like these, which is totally fine. All it is like little tubes in here, or one tube that's a different color, and you just draw it. Then you put it back, make sure you label everything, you put it back, and you send it off. I just drew my patient's blood. I labeled those tubes, and now I'm just cleaning off the seats. Thoroughly, very thoroughly. Break time. So as a phlebotomist, whether you're in a hospital or outpatient, inpatient, doctor's office, just working as a phlebotomist, you do have a time limit to draw. If you think it's gonna take you about 10 minutes or 15, no, you'll get in trouble. So there's always gonna be a standard, and at my job, it's 5 minutes. So you have to go over your requisition form. A requisition form is gonna be like the patient's information, name, last name, first name, last name, middle name, date of birth, their address, their doctor's information, their doctor's address, fax number, because you have to fax the results. So you're going to have to go over all of that information and draw within 5 minutes. Some companies are more lenient, maybe between 5 to 10 minutes, but my company specifically where I work, it's 5 minutes. And we have to get them in and out while still providing patient care and showing that you are passionate with your patient. You're just gonna have to go over everything with them to make sure everything is correct. You do not want an incorrect requisition form. You do not want an incorrect date of birth, because that's just a violation of so much. Make sure you go over patient information very thoroughly and you get them in and out. At my job, it can be a bit challenging. That's why I said before, if I see that I'm running low on supplies, I have to hurry up, clean up again, stock again. I have to hurry up and reload, because you have to get a certain amount of patients in a certain amount of time. That's what they look for. A lot of companies, oh wow, she drew 40 people in the span of 4 hours. That is amazing. Or 50 people in 4 hours. That's like top tier, Or 70 people and up in the span of 8 hours. I'm on break right now, so I'm just talking to you guys on break. Okay, guys, now I am headed back to work. Okay, I'm back from break. Now, listen up, all you phlebotomists and RNs. I know this part can be a bit challenging in regards to, how to look up the test tube colors for the ordered tests, but I'm going to show you an easy way to do so. Go to Google. You can go on your Internet Explorer on your phone, type in LabCorp test menu. LabCorp test menu. Search our healthcare test menu. We are now at LabCorp test menu. So to look up your tests, the ordered tests from the physician. Let's say the doctor ordered a CBC. We're gonna type in CBC, and then we're gonna look. Here's the test code for it at LabCorp. But this is for any lab. A CBC is always gonna be in a lavender top tube, but we're just gonna double check. So we're gonna click on here, CBC with diff. There's some, make sure if it's without diff or with diff, okay? So we're gonna click on this. So now we have made it to the complete blood count specimen requirements page. So what we're gonna do, we're gonna scroll down. It says the volume, the tube needs to be filled completely, okay? The container type is lavender top, EDTA tube. And then the collection, you need to invert the tube after you collect it 8 to 10 times. All right, so we are gonna draw a lavender tube, all right? And that, my friends, is how you look up the test tubes for the order tests on your recs. I know it can be a bit challenging sometimes. You have no idea what tubes go with which tests. So I just made it easier for you. Go to LabCorp, and then go to their test menu, type in your test. After you type in your test, you hit the test, you scroll down, and it'll give you all your specimen requirements for that test. We are now getting into the meat and potatoes of this vlog. You're gonna see someone draw my blood, and then we're gonna go over how to draw your patient's blood step by step. Okay, you guys, I'm gonna have my coworker draw my blood.
Go ahead. I don't know what I'm gonna say.
How's my hair?
What?
No, I'm kidding.
What tube?
Anyone. I'm going to show you how to properly draw blood.
Okay, so we put the tourniquet, make sure it's tight. Then
We palpate
we palpate.
for the vein.
Bend it a little. See, there's 2 veins there. Okay, so I'm gonna go for this one. Circle. I like to stretch the skin back a little bit and poke.
Good job.
And there it is.
And then we always untie the tourniquet first.
Yes, now we untie it.
And then take
Take
the
the
tube.
tube out. Take the needle out. Pop the whatever it's called. Make sure it's not bleeding. It is, but it's okay. We're gonna tie this tight. And there you have it.
Thank you. Look at my blood.
Now we could clone her.
Now we can clone me. Oh my gosh. I have to throw it away now. Goodbye. Goodbye. I wanted to show you guys what a blood draw looked like. I volunteered myself for you guys. So your equipment needed, your blood collection tubes, of course, your sterile gloves, your needles of all different sizes, your tourniquet, your alcohol, swabs, your gauze, and your laboratory forms, your specimen labels, your transport bags, and your shops container. My RNs and phlebotomists, don't forget your hand sanitizer. Number 2, wash your hands. Proper hygiene is essential to safely performing a venipuncture, you guys. All right, let's get into it. We have to ready our patient for the blood draw, so introduce yourself and ask for the patient's full name and then verify the full spelling of their name. Double check that patient's date of birth. You don't want to get that wrong. Make sure it matches the name on the lab form. And ask if the patient has any allergies or has any complications during any previous blood draws. Ask your patient if they have any devices in their body or arm, and make the patient feel comfortable as possible to relieve their fear of getting jabbed. And lastly, make sure you get their consent. It's important to disinfect the site before drawing blood to reduce the chances of contamination. You got to cleanse the site with a 70% alcohol swab by starting from the center of the venipuncture site and working outwards clockwise, covering roughly 3 centimeters. And be sure to allow the area to dry to reduce the risk of contamination. And whatever you do, do not touch the disinfected site, please. Then you'll have to restart the process over again. Here's an example how you palpate for your vein before you do your blood draw. You want to make sure you press down on the skin 1 or 2 fingers for a healthy bounce back. And remember, don't leave the tourniquet on the arm no more than 60 seconds. All right, it's blood draw time. Ask the patient to extend their arm, tie the tourniquet around their arm 3 to 4 inches above the venipuncture site. Ask them to make a fist and palpate for a vein, which inspecting the antecubital fossa. Look for a visible, good-sized vein, which will be the median cubital vein. Here are your 3 veins: cephalic vein, median cubital vein, and basalic vein. The cephalic and median cubital veins should be your first choice. Your last choice should be basalic vein. Cephalic and median cubital poses a less risk. In regards to the basalic vein, it poses a higher risk due to the fact that it crosses the brachial artery, and it's hard to anchor. The cephalic and median cubital veins have a lower tendency to roll when you insert the needle into the vein. Next, place your thumb below the venipuncture site to anchor the vein. Be sure not to touch the venipuncture site, or you will need to repeat the cleaning process all over again. Puncture the vein quickly and at a 30-degree angle or less. Once the blood has been collected, first release the tourniquet. Be sure to do this before removing the needle from the vein. Slowly withdraw the needle and apply pressure to the venipuncture site with a clean gauze or cotton ball, and have the patient hold the gauze while their arm is extended. Be sure to fill your tubes up with blood, as you do not want the lab to reject your blood specimen. Next, after you complete your blood draw, immediately throw away your used dirty needle into the sharps container, and be sure to throw away any remaining contaminants. Next, invert your tubes by the lab invert requirements. Lastly, labeling and cleanup time. Label your blood tubes. Double check that the labels in the forms are completely and accurately filled out. Perform a check on your patient by asking them how they feel, and thank the patient and let them know that the procedure is now completed. Now, go wash your hands. Be sure to wipe down your area with disinfectant spray. Oh, and here we go. It's about midday. I've already drew so many patients, as you can tell, and I just have to restock. I have to wipe down everything, sanitize everything, restock, get this sharps container out of here, replace it because it's almost full. So I'm gonna go back in my processing room, restock. I'm now just going to change this out. Clean, organize. I am now going to get some food. It is 11:55 a.m. I'm on my lunch break. Normally I go home on my lunch breaks because I live close by. So I'm gonna DoorDash some food to my house and then I'm gonna eat at home. So this is what I come home for, to be with my family on lunch and to eat some bomb Mexican food. These are bomb. Ooh, that was good. That was yummy. Okay, I am now headed back to work. I like to go home and eat and just rest. I only have an hour for lunch, and I just love to just hang out with my family, eat, and now I'm headed back to work. Alright, I'm gonna wash my hands and then put on my PPE and then clock back in.
Will be logged on June 2nd, 2022 at 12:57 p.m.
Thank you guys for watching my channel. I am headed home.